Hello, my name is Netz, and I'm a student PT, and we're going to be doing some cranial nerve testing in this video. And so we're going to be going over cranial nerves 9 and 10, which is glossopharyngeal and vagus nerves. And first, I just want to talk about it, and then we're going to do some reflex testing. So the glossopharyngeal nerve it serves a motor function to the pharynx and the parotid gland, and then it's going to do sensory to the soft palate, the middle ear, the posterior 1/3 of the tongue, and it will also do taste to 1/3 of the tongue, and it's also going to do sensation to the pharynx. And then for the autonomic function, it's going to signal the blood pressure in the carotid artery. And then the nuclei for the glossopharyngeal nerve are going to be the spinal nucleus of 5, and they're all located in the medulla. There's 4 of them. It's going to be the spinal nucleus of 5, the solitary nucleus, the salivatory nucleus, and the nucleus ambiguus. And then for the vagus nerve, that does motor to the muscles of swallowing, so pharyngeal muscles, and the muscles of the voice box, which are the laryngeal muscles. And then it's going to do sensory to the pharynx, the meninges, and part of the external auditory meatus. And then it's going to also have a parasympathetic function that's going to regulate the heart, the lungs, and the GI. And then it's got 4 nuclei as well that are in the medulla, and those are going to be the dorsal motor nucleus of 10, the spinal nucleus of 5, the nucleus ambiguus, and the solitary nucleus. Okay, and so now we're just going to go ahead and do the reflex testing, which is the gag reflex, and then we're going to look at the uvula. I'm going to have my patient say ah, and we'll look at that. So first we're going to try to initiate a gag reflex, and so I'm just going to lightly touch the pharynx, the back of the throat, with the tongue depressor. Okay. Ready? Mm-hmm. Okay. And so you just want to be really, really gentle and see if you can get the gag reflex. And so she had a gag reflex there. If I wasn't able to initiate a gag reflex, I could also just gently touch the pharynx to see if my patient was able to notice a sensation there. So if she could feel me just gently touching the pharynx is what I would do. And then I'm also going to ask her to just open her mouth and say ah for me. Ah. And so we're looking at the uvula, and her uvula goes straight up, and you may see that the uvula will deviate to one side or another if you have an injury to one of the spinal nerves, one of the cranial nerves 9 or 10. And so that's it. Thank you very much.